Number 2, Honourable Annette.
On a totally another issue, Mr Speaker. What recent reports, to the Minister of Health, what recent reports has he seen on inadequate standard of health care in New Zealand?
Honourable Tony Ryall.
Mr Speaker, the vast majority of reports I receive on the standard of health care in New Zealand are very positive. However, I have seen a recent report about a small group of women whose experiences with maternity services at Counties Manukau were disappointing. It's unacceptable if any mother feels unwelcome or disrespected by maternity services, and I have asked the District Health Board to report to me on what action it is taking to address these concerns.
Supplementary question, Mr Speaker.
Supplementary question, the Honourable Annette.
Why wasn't the so-called increase in funding to Hutt Valley DHB sufficient to prevent a recent audit report showing conditions at the maternity ward, the mental health unit, the children's ward were so concerning they were labelled as high risk, with staff shortages and overcrowding and a recurring flea problem that had been there since he became the minister?
Mr Speaker, our government's given the Hutt Valley District Health Board an additional $59 million in the last 5 years. We have also supported much stronger auditing processes in district health boards. I'm advised that with respect to Hutt Valley District Health Board, they are addressing the issues that have been raised. New lino has been installed and the maternity unit is apparently fumigated. I'd have to remind the member that fleas were reported at another hospital back in 2007 and in a hospital facility back in 2002. Who was the Minister of Health?
Order.
Supplementary question.
Order. Supplementary.
Supplementary question.
Supplementary question, the Honourable Annette King.
Why wasn't the so-called increase in funding to Counties Manukau DHB sufficient to address the serious shortcoming in maternity care, including bed shortages, inappropriate care, overcrowding, and vulnerable women being sent home 4 hours after birth, after his promise for longer stays for mothers in hospitals, the one he made in 2008-09?
Honourable Tony Ryall.
Mr Speaker, over the last 5 years, we've given the Counties Manukau District Health Board $265 million of additional funding. There was a major review of maternity services that was commissioned in 2012. It identified that there were significant problems with dealing with vulnerable mothers, particularly new Pacific and Maori mothers, and this research has been undertaken to inform the DHB, and I'm sure we're going to see improved services as a result.
Point of order, Mr Speaker.
Point of order, the Honourable Annette King.
Mr Speaker, I seek leave to table a document sent to me under an OIA request from Counties Manukau showing that over 4 years there's been no improvement in the length of stay for vulnerable mothers at Counties Manukau.
Leave is sought to table an OIA request that has been sent to the member. Is that...
It was a reply to
a reply. I apologise. Is there any objection to that particular document? There is objection. Further supplementary?
Oh, brown bag.
Supplementary question, Honourable Annette King.
Why should mental health patients in Christchurch be forced to live in portacom and caravans, which both health professionals and board members are concerned about, even going so far as to label the proposed...
I don't want your colleague there to continue to hold up pieces of paper which is leading to disorder.
We're allowed to.
I have asked the member to desist from doing so. That is the end of the matter. Supplementary.
Point of order, Mr Speaker. Point of order, Mr Speaker.
Point of order.
Mr Speaker, for many, many years that I've been in this Parliament, the use of visual aids, including you allowing me to use them only a few weeks ago, was permitted, and why is it not now?
Because it is leading to disorder. A visual aid might be one thing to hold up lots of pieces of paper. Copies of the paper is not helping the order of this House. I have made a ruling. If the member wishes to carry on with his supplementary questions, I suggest she do so.
Oh, Mr Speaker. Point of order, Mr Speaker.
Order. This is a point of order. It will be heard in silence.
Sir, could I point you to Standing Order 109?
109.
109, sir. And it says this: a member may use an appropriate visual aid to illustrate a point being made during the member's speech, provided that the aid does not inconvenience other members or obstruct proceedings.
Order!
The second point, sir, says such an aid may be displayed only when a member is speaking to a question before the House and must be removed from the chamber at the conclusion of the member's speech. I'd put it to you, sir, that the visual aid itself was innocuous. It was directed at the member's question that was being asked, and it has been a tradition to use visual aids as long as they are removed relatively quickly after the speech, sir.
Order. Order. I invite the member to look very carefully at that Speaker's ruling. What it says, that particular standing order, what it says is the member can use a visual aid if the member specifically needs a visual aid to help that member make a point with a supplementary question. What we're seeing was an additional member of Parliament, not the member asking the question, having to use the visual aid, which was, in my opinion, leading to disorder. Now, if the member... Order! If the member asking the question finds that it's absolutely critical to making the point she's making, I will allow that member, but not any other member, to use that aid to assist the annexing. Supplementary question.
Thank you, Mr. Speaker. It is critical to my question. Why should mental health patients in Christchurch be forced to live in portacom and caravans, which both health professionals and board members are concerned about, even going so far as to label the proposal as low-life ghetto, when he was aware of the unprecedented demand for mental health services in Christchurch since the earthquake and has washed his hands of the problem?
Honourable Tony Ryall.
Oh, Mr. Speaker, we've been strongly supporting the Canterbury District Health Board since the earthquake. In the last 5 years, $201 million of extra funding gone into the Canterbury District Health Board. There are significant housing issues in Christchurch which are being dealt with, and work is underway in that area. But I do welcome any thinking the District Health Board can have about how it might be able to provide services for some of those more vulnerable people in the community in a temporary basis until a more permanent accommodation can be provided.
Question, Mr. Speaker.
Question, the Honourable Annette.
Has he received... Yes, we've just heard from the Brains Trust.
Order. Does the member want to continue with her question?
Has he received any reports from frontline health professionals that on numerous occasions patient safety is compromised due to care rationing, patients missing out on care or treatment delayed, and reportable events often not getting past frontline managers? Has he received any of those reports?
Honourable Tony
Mr.
Ryall.
Speaker, I'm sure I've read some of the newspaper clippings that the member is using for those reports, but I've also seen reports of people waiting 3 days on end under bright fluorescent lights at hospital emergency departments during the term of the previous government. Next week, we'll be announcing the best performance ever by emergency departments in the New Zealand Public Health Service.
Point of order, Mr. Speaker.
Order. Order. Point of order, the Honourable Annette King.
I seek leave, Mr. Speaker, to table an email I have received from a health professional working in a tertiary hospital setting out exactly what I have just put in my question. I'm sure the Minister has also received it.
Then we don't need any further explanation. Leave is sought to table an email received by the member from a health professional. Is there any objection to that email being tabled? There is objection. Order. Order. Point of order. Point of order, the Honourable Clayton.
Mr. Speaker, I seek leave to table a set of statistics from NZ Doctor. I'm advised it's similarly limited in its availability as Mr. Haig's information from NZ Doctor, because it's behind a paywall. A set of statistics which notes as its headline, Labour's King gains as Ryall slips in popularity.
Order. Well, I'm going to let the House decide. Leave is sought to table that particular information behind a paywall. Is there any objection? There is objection. Order. Order. And I don't like the noise of level of interjection either. Question number 3, Shane Arden.
Thank you, Mr.